I just need a couple of minutes quickly to attend to her.
Nobody's home but you?
Mm-hmm.
Oh, no. Hare Krishna, everyone.
Hare Krishna.
Hare Krishna.
Hare Krishna Karuna Purna Shakti Mataji.
Hare Krishna, Prabhu.
Hare Krishna, Greg Prabhu. Is that our Greg, Nurse Greg? Yeah, Greg Locke. There you go.
Hey Dimas, nice to see you. It's nice to see familiar, faces.
Hare Krishna, everybody.
Hare Krishna.
Mataji.
Hare Krishna, Prabhu. Shamanjari. Surendra Krishnan.
How's everyone doing?
Everyone had a nice week. Was it Govardhan Puja this past week? Yes. Yeah, this past week. My Kanai Dowji Sheilas were on the hill at Philadelphia Temple. It was nice.
One day maybe you can show your altar. It's so beautiful to everyone.
I wouldn't know how to do that. I would love to. I don't know anything about the technology. I don't know. I mean, I could bring up the picture, but Lord
Like
knows.
maybe bring the camera to them and show. Yeah. I guess we can start. It's nice to see familiar faces. Shamalota Mataji, Arvind, Dagmar, Greg, Haiti, Garapurna Shakti Mataji, Kavita, Shama Manjari, Surrender Krishnan, Yuvati, Hare Krishna. Okay, so let me share the screen where we left off. Can everyone see the screen?
Yes.
Yes, okay, great. Is there anyone who would like to read?
I just ran to get my book. Does anybody have their hand up? I lost my glasses, so I'm waiting for mine to get sent. So it's going to be hard for me to read.
Karunapurna Shakti Mataji, thank you.
Cerebrovascular disease, CVA. Cerebrovascular disease, CVA, is also referred to as a stroke. A stroke most commonly occurs when a blood clot breaks an artery carrying blood to the brain, or when one of these blood vessels breaks. In either case, blood flow to a portion of the brain is interrupted. Therefore, oxygen to that part of the brain ceases as well. Within minutes or a few hours after a stroke begins, the brain cells in the immediate area die. This area of dead brain cells is called infract. The dead cells, which release a chemical that creates a type of chain reaction that kills cells in surrounding areas of the brain, where blood flow is compromised but not completely blocked. This chain reaction occurs quickly. Therefore, it is believed that the first 6 hours after stroke symptoms occur is crucial for medical intervention. Once the stroke begins, every second counts in order to increase one's chance of recovery. Some risk factors include diabetes mellitus, hypertension, high blood pressure, arteriosclerosis, a thickening and hardening of the artery walls, gout, increased triglycerin levels, family history of CVA, decreased exercise, use of oral contraceptives, and cigarette smoking. A patient will develop loss of certain abilities depending on which part of the brain is affected by the stroke, as well as the size of the area of dead cells. Loss of function may involve movement, speech, and memory. A small stroke may leave only weakness in an arm and leg, for example, whereas a larger stroke may leave one paralyzed and unable to speak. If a stroke occurs on the left side of the brain, the right side of the body is affected. If it occurs on the right side of the brain, symptoms occur on the left side of the body. CVA is the third most common cause of death in the United States, attacking mostly older adults. It can, however, occur at any age. Diagnostic tests include computed tomography, CT scan of the brain, a lumbar puncture, spinal puncture, an electroencephalogram, EEG, and an angiogram.
Great.
Anyone else like to pick up from here?
Does anybody have a comment about somebody they knew or took care of or had a family member who had that illness happen suddenly or took care of
Hi,
someone?
hi, Bull. It's Kavita.
Hi.
I I looked after my grandmother. She stroked. She was hemiplegic. She stroked when I was 13. And my mom is a nurse, so we took care of her at home. We had some help from home care. She had some paralysis. Her speech was unaffected. Her cognition was fine. But she lost the mobility and her balance. So we looked after her for several years until she died. She died at home, and we cared for her until the end. This is many, many years ago. But we were happy that we were able to care for her at home and she didn't have to go into long-term care because really, had we not been able to do that, she could never have lived independently. It was very sad. She was young. She was 72.
She was 72 when she had a stroke.
She was 72 when she died.
Oh, when she died. Wow.
Yeah. Yeah.
Wow. That's really a blessing for her that she was able to stay at home and get care from two people that really loved her and cared about her.
Yeah, we all left her. The whole family was here. And the night that she died, my mom will never forget. She was very spiritual. She was always chanting. And she had vanilla ice cream. My mom stayed with her and then she went to sleep and she would have a bell. Her bell was her way of ringing, like if she needed help with something. But she was ringing her bell, but because she was seeing Krishna, we think, she never didn't want anything, but she was so sort of her mind was so focused on Krishna. It was something.
Wow.
That's the first time that I saw like a dead body. I was 13.
Really?
Yeah.
Well, that's a pretty auspicious death, I'll tell you.
Yeah.
That's an amazing departure to see.
Yeah. It was
Whether it was the first time or the 10th time. It's
yeah,
pretty amazing.
she was a beautiful, beautiful person. Anyway, that's my experience with stroke. So
For sharing, Kavita.
Haribo.
Hare Krishna.
Very well. Thank you for sharing that. It's a
Thank you.
beautiful story. Beautiful.
Yeah. Anyone else would like to continue or?
I'm happy to read.
Greg, yes. Hare Krishna.
Okay, Hare Krishna. Okay, chronic obstructive pulmonary disease, COPD, is an airway obstruction that can result from many conditions such as emphysema, chronic bronchitis, cystic fibrosis, or asthma. Often a patient may suffer from more than one of these illnesses before COPD develops. It is a chronic condition that tends to worsen with time. Cigarette smokers are at high risk of developing COPD. chronic lung infections and allergies may also contribute to the disease. Symptoms can include a chronic cough, shortness of breath on minimal exertion, an anxious feeling, audible wheezing, tachypnea, rapid respirations, tachycardia, rapid heartbeat. Diagnostic testing for COPD include a chest X-ray, pulmonary function tests, blood tests, and an EKG or ECG, electrocardiogram. In end-stage COPD, patients generally require constant oxygen therapy and may have extreme difficulty breathing even when in a sitting position. Understandably, patients with advanced chronic obstructive pulmonary disease usually exhibit a tremendous amount of anxiety.
You can continue if you like.
Yeah, okay. Congestive heart failure, CHF, is a disease in which the heart becomes inefficient and cannot pump enough blood to meet the demands of the body's organs. As blood flows too slowly from the heart due to diminished cardiac output, the blood returning to the heart backs up and causes congestion in the tissues. As a result, edema, swelling can occur, usually in the patient's legs and feet. Fluid can also form in the lungs, which can cause breathing difficulty. Pulmonary edema is an acute life-threatening condition. Congestive heart failure can cause kidneys to inadequately rid the body of sodium and water, a condition that also contributes to edema. CHF often occurs on the left side of the heart, but can also develop on the right side. Sometimes left and right-sided heart failure can occur simultaneously. Symptoms of CHF differ according to which side of the heart is affected. For example, left-sided heart failure may cause dyspnea, difficulty breathing, tachycardia, rapid heartbeat, edema, weight gain, fatigue, and muscle weakness. Right-sided heart failure may cause edema, distended neck veins, and hepatomegaly, and enlarged liver. There are many causes of congestive heart failure. Some common causes include coronary artery disease, the narrowing of arteries that supply blood to the heart, myocardial infarction, a previous heart attack that leaves scar tissue to interfere with the heart muscle, hypertension, high blood pressure, previous rheumatic fever, congenital heart disease, heart defects present at birth, an infection of the heart valves or muscle, such as endocarditis or myocarditis. Diagnostic tests to determine if someone has congestive heart failure may include a chest X-ray, an EKG, cardiac catheterization, and an echocardiogram. Prognosis of the disease depends on the cause and its response to treatment.
Anyone else would like to continue? Maybe we can
I'm
correct
happy
it.
to continue for this
Sure.
this section.
Thank you.
Okay. Diabetes mellitus is a chronic disease caused by inadequate production of insulin or the inability to utilize the insulin produced. Both men and women are equally affected. The incidence rises with age. Type 1 diabetes refers to a condition in which a person secretes little or no insulin. This is called insulin-dependent diabetes mellitus, IDDM. In the past, it was referred to as juvenile diabetes. IDDM usually occurs before 30, although it can occur at any age. Type 2 diabetes, or non-insulin dependent diabetes, NIDDM, which is why we use a lot of abbreviations in the medical world, because having to write that out a lot. A patient develops insulin resistance or insufficiency. It is sometimes called adult onset diabetes and usually occurs in patients after age 40. Is most frequently treated with diet and exercise, although oral hypoglycemia medication hypoglycemia medication may be required. Type 2 diabetes is more common than type 1. Diabetes causes disturbance in the metabolism of carbohydrates, protein, and fat. It is a chronic, incurable disease, but symptoms can be controlled with proper therapy. Hereditary factors play a key role in developing diabetes. Other causes that may attribute to the disease include obesity, physiologic and emotional stress that causes prolonged elevation of stress hormones, resulting in elevated blood glucose levels, which increase demands on the pancreas, the organ that helps produce insulin. Pregnancy that increases levels of estrogen and placental hormones, and certain medications that are known to antagonize the effects of insulin. Patients with diabetes mellitus are at risk for two very serious metabolic complications caused by hyperglycemia, increased blood sugar levels, called diabetic ketoacidosis, DKA, and hyperosmolar non-ketotic syndrome, HNKS. These are acute, life-threatening conditions that can lead to dehydration, shock, coma, and death, and they therefore require immediate medical attention. Diabetic patients are also at risk for developing chronic illnesses such as cardiovascular disease, peripheral vascular disease, often leading to amputation of lower limbs, severe hypertension, increased blood pressure, retinopathy, a disorder that the retina that can lead to blindness, nephropathy, a disease of the kidneys, and peripheral neuropathy, a disease of the nerves, usually causing pain and numbness in the hands and feet. Signs and symptoms of diabetes mellitus may include weakness or fatigue, polyuria, increased urination, polydipsia, excessive thirst, dry mucous membranes, weight loss in IDDM, and polyphagia, eating excess amount of foods in IDDM. Diagnostic tests include various blood and urine tests. Occasionally, hospice patients with cancer of the pancreas may develop diabetes secondary to their cancer. In any hospice patient with diabetes, care is taken to avoid hyperglycemia, increased levels of blood sugar, or hypoglycemia, decreased levels of blood sugar. Symptoms of hypoglycemia include headaches, confusion, dizziness, sweating, irritability, or tremors. If not treated, hypoglycemia can lead to seizures and coma. Signs and symptoms of hyperglycemia may include excessive thirst, frequent urination, fatigue, weakness, abdominal pain, nausea, vomiting, fruity breath, drowsiness, flushed skin, and general discomfort. If a patient was taking insulin medications prior to the hospice admission, it is generally continued even if the patient stops eating because the liver continues to produce glucose. Once the patient becomes unresponsive, unconscious, insulin is usually stopped in patient care.
Thank you. Does anyone else like to continue?
I can read if I can make the screen a little bigger. Yeah, I'll continue with hepatitis.
Yeah, the problem if I make the screen bigger, then it.
No, not you, me. I said I
Oh,
can.
okay.
Okay. All right. Hepatitis. Hepatitis is a disease causing inflammation of the liver. There are many types of hepatitis viruses, some with higher risk of complications than others. Hepatitis may be acute, meaning it has a sudden onset with severe symptoms, but runs a short course. Hepatitis may also be chronic, meaning it is of long duration and or slow progression. Patients with chronic hepatitis are at risk of lasting liver disease. This can be of a serious nature because the liver has many functions, including storing iron, vitamins, and minerals, producing bile to help in digestion, acting as a filter to convert poisonous chemicals to substances that can either be used by the body or excreted from the body, converting food into stored energy, producing new proteins, producing clotting factors so blood can clot, types of viral hepatitis. Can you lift it up a little bit, please? Thank you. Hepatitis A, formerly known as infectious hepatitis, is highly contagious. It is transmitted by the fecal to oral route. It can result from ingesting contaminated milk, food, or water. The hepatitis A virus enters the digestive tract and begins reproducing. It then spreads to the liver and multiplies in the liver cells. The incubation period, the amount of time between infection and the development of symptoms, is usually 2 to 4 weeks. Symptoms may include fatigue, abdominal pain, decreased appetite, nausea, diarrhea, and jaundice, in which the skin and the whites of the eyes become yellowish. A complication that can occur with hepatitis A is a relapse after apparent recovery. If desired, a vaccine is available for long-term prevention of hepatitis A virus infection for those 2 years of age and older. Okay, for those 2 years of age and older. Hepatitis B. Hepatitis B virus is transmitted through exchange of contaminated blood, intimate sexual contact with contaminated bodily secretions and feces, and from mother to child. The hepatitis B virus can cause lifelong infections, cirrhosis, scarring of the liver cancer, liver failure, and death. The average incubation period for hepatitis B is 2 to 3 months. Initial symptoms may resemble the flu, fatigue, abdominal discomfort, fever, decreased appetite, nausea, and diarrhea. Other symptoms include dark urine, pale stools, and jaundice, yellowish eyes and skin. Invasive diagnostic testing includes a blood test and sometimes a needle biopsy of the liver to test for the virus and liver damage. In general, hepatitis B is treated over a period of 4 months with a medication called interferon that is given by injection. In advanced stages where liver function ceases, a liver transplant may be needed. A 3-step vaccine is available for all age groups to prevent the virus. Healthcare workers are at increased risk of being infected by hepatitis B due to the presence of infectious materials in their workplace. In some countries, including the United States, the 3-step vaccine is mandatory for all employees working in healthcare facilities. Hepatitis C, HCV, is transmitted through contaminated blood and bodily fluids from mother to child, as well as intravenous drug use, presently the most common type of transmission. It is now known that hepatitis C is rarely transmitted sexually, and studies show that sexual transmissions account for less than 5% of cases. Even with such a small percentage of cases known, extreme caution is still strongly advised. High-risk groups include intravenous drug users, kidney dialysis patients, healthcare professionals, persons with multiple sex partners, recipients of blood transfusions before July 1992, and infants born to infected mothers. It is believed that the risk of neonatal transfer of the hepatitis C virus increases if the mother is infected with HIV. The incubation period for hepatitis C is usually 6 to 9 weeks. The infected person may feel a sudden onset of flu-like symptoms that seem to linger. Others may gradually develop symptoms over a long period of time. Symptoms may include fatigue, low-grade fever, headache, sore throat, decreased appetite, nausea, vomiting, aching joints, dark urine, light stools, and pain in the right side over the area of the liver. In some cases, jaundice may appear. Hepatitis C is a progressive disease that can cause death due to liver failure or hepatocellular carcinoma, which is liver cancer. Okay, remember this book was written a few years ago, so they've made a lot of progress with hepatitis C since then. HCV-related chronic liver disease may take up to 20 or more years to develop. It is now known that hepatitis B and HIV are often present in patients with HCV. Therefore, testing for each of these diseases is indicated. Screening for HCV is not routine. However, patients in high-risk categories should consider screening. These include the following: those with a history of IV drug abuse, those with chronic hemodialysis, those with a history of blood transfusion before June 1992. That's before they started testing the blood for that. Living in the same house as someone with HCV, sexual partners of someone with HCV who is in a non-monogamous relationship, history of sharing intranasal devices for drugs such as cocaine, those with a history of liver disease, healthcare providers who received a needle stick injury from a person with HCV. Screening for contact with blood or body fluids from someone known to have the hepatitis C virus starts immediately after exposure. Testing is repeated in 4 to 6 months if the first test is negative. The HCV RNA test can be administered as early as 4 to 6 weeks. Hepatitis D, also called delta hepatitis, is caused by a very small virus that cannot replicate on its own. Instead, it requires the presence of the hepatitis B virus. Now, this is an interesting one. Hepatitis D can become chronic and is found only in patients with hepatitis B. Okay, so this is a little complicated. It can cause a patient with a mild case of hepatitis B to develop a severe chronic hepatitis and cirrhosis of the liver. It is estimated that hepatitis B is responsible for about 50% of fulminant hepatitis cases, which is a rare form of hepatitis that causes massive damage to the liver and eventually can lead to coma and death, possibly within 2 weeks. As the disease progresses, the patient may experience cerebral edema, that's swelling in the brain stem compression, gastrointestinal bleeding, respiratory failure, cardiac failure, and kidney failure.
I
These
think
are not,
Lolita Priamataji has her hand up. I think she'd like to continue from here. If that's
uh,
okay.
okay, yes.
Thank you.
Hare Krishna. If I may just ask what fulminant means, like
Uh,
hepatitis D is.
I was I was thinking somebody would ask that, so I was going to ask Taravali, can you get on your computer dictionary? Because I remember looking it up, but I don't remember the exact
Sorry,
dictionary.
what was the question?
Well, fulminant.
It says that it is estimated that hepatitis D is responsible for about 50% of fulminant
No,
hepatitis cases.
F,
Is that a medical term, Dear Sangeeta Mataji?
it's FULMINANT. I just want to not confuse you and give you the wrong definition, Lolly, okay?
Thank you. Sorry for this question. Sorry, hope I'm not
No,
delaying.
no, I want you to ask,
Fulminant.
because I was thinking, what was that definition for that word?
It's
Oh,
usually it's used in medicine. It's
yeah,
of a disease or symptom, so it means severe and sudden in onset.
okay, so 50% of the hepatitis cases that are severe and suddenly come on, okay, are they estimate that 50%, go down a little bit, please, is estimated that hepatitis D can become chronic and is found only, I need you to go down a little bit, please. Okay, thank you. Okay, so it's caused by a very small virus that cannot replicate on its own. Hepatitis D is what they're talking about. D for Delta. Delta hepatitis cannot replicate on its own. It requires the presence of hepatitis B. Okay, so you need B to get to have hepatitis D. So you need them both together, B and D. Okay,
Oh, thank you.
does that make sense?
Yes, yes.
Okay.
Thank you so much. Thanks, Taravali.
And it
Hare
does,
Krishna.
I just want to mention that it can cause severe cirrhosis of the liver. And when I was a brand new nurse, I remember thinking that cirrhosis of the liver comes from alcohol abuse. And I had one woman who was an elderly lady and was never had a drink in her life, but was in the hospice unit dying of cirrhosis of the liver. And her husband pulled me aside and explained to me, I just want you to understand, my wife never drank a day in her life, never ever had a drink. This came from hepatitis. And he's the one that taught me. It was interesting because when I read about hepatitis D now, I think of this couple because he's the one that taught me about hepatitis D. And that's why she had cirrhosis of the liver. It wasn't from alcohol. I wish we could see everyone and if I could do a hand raise, how many of you ever thought that cirrhosis of the liver came from something other than drinking? Because it's a big myth in this world that cirrhosis of the liver comes from alcohol abuse. And it definitely can, but it's not the only cause because hepatitis D can always also be the cause. So I learned that the hard way. They were a lovely elderly couple who never drank. And here she was with the same. Yeah, it's pretty harsh. Anyway,
Yeah, thank you, Mother.
does somebody
Thank
else
you.
want to take over the reading?
Yes, Mother. I'll read it. I'll
Oh,
start
thank
reading.
you, Holly. Thank you.
Thank you. Thank you so much. Hepatitis E is a virus transmitted through the fecal to oral route, similar to hepatitis A. As in hepatitis A, it first enters the gastrointestinal tract, begins reproducing, and then spreads to the liver, where it multiplies in the liver cells. Hepatitis G is a virus transmitted through contaminated blood products. As in hepatitis B, C, and D, it enters the bloodstream, travels to the liver, and begins to reproduce. When the body's natural defenses attack the infected cells, the liver becomes inflamed. Multiple sclerosis. Multiple sclerosis, MS, is a debilitating disease affecting the brain and spinal cord. It's a major cause of disability in young adults, usually striking between the age of 20 and 40. It is more common in women than in men. There are five main types of MS, ranging from relatively mild symptoms that do not worsen and do not cause permanent disability to progressive deterioration without periods of remission. In a small number of MS patients, the disease progresses rapidly, sometimes causing complete disability and death within a few months of onset. MS causes inflammation in portions of the nervous system that results in the destruction of the myelin sheaths that cover the nerve fibers. Areas of sclerosis or scarring remain that inhibit nerve signals. This can lead to visual impairment, muscle weakness, numbness, decreased coordination, paralysis, tremors, urinary and bowel incontinence, mood swings, and difficulty with speech. In advanced stages, patients can exhibit forgetfulness and confusion, sometimes referred to as MS dementia. As of this writing, the exact cause of MS is unknown, but a great deal of research has led to some possibilities, including a slow acting viral infection and an autoimmune response of the nervous system, meaning the immune cells in one's body destroy the cells that produce myelin sheaths or the nerve fiber covering. Diagnostic tests may include an electroencephalogram, EEG, a lumbar puncture, psychological testing, and a CT scan. Parkinson's disease. Parkinson's disease is a slow progressing neurological disease. On average, deterioration progresses over a period of about 10 years. Men are affected more often than women. Onset usually occurs in middle age or older, but may also occur at a younger age. It is believed that the cause of this illness is a deficiency in dopamine, which prevents brain cells from performing their normal function within the central nervous system. Death usually occurs from aspiration pneumonia or another type of infection. In general, symptoms progress to muscle rigidity, cramping in the neck, trunk, and legs, tremors, difficulty walking with frequent falls, a high pitched monotone voice, flat affect, lack of facial expression, body bent forward, difficulty swallowing, and eyes fixed upward. Much research is being done to discover a cure for Parkinson's disease, but at present none exists. Treatment involves replacement medication for decreased dopamine levels. Often this decreases the severity of symptoms. Physical therapy is also used to help maintain normal muscle tone. In some cases, patients may opt for neurosurgery, but this is usually more of an option when the patient is comparatively young and otherwise healthy. Surgery is not a cure and is performed for palliative reasons to help relieve symptoms. A great deal of spiritual and emotional support is needed for patients with this cruel and debilitating illness. In conclusion, I hope this chapter has provided you with enough information to serve as a starting point from which you can build more detailed knowledge on the subject of concern.
I think we have a few more minutes. Maybe we can just get into the grief process, just read this first section and finish off
Okay,
here.
okay. Is it okay if I continued reading or?
Sure, unless anyone else would like to read. Just give a chance to anyone else. Sure, Mataji. Go ahead.
Chapter 5, the grief process. The time between diagnosis of a terminal illness and passing away can be filled with significant emotional and spiritual growth, not only for the patient, but for the caregiver and family members as well. It would be a remarkable achievement if the sense of peace that seems to come with accepting the eventuality of one's death or that of a loved one could be easily gained without a great amount of endeavor. Unfortunately, this is not always the case. For the patient, coming to terms with imminent death may cause such crippling anxiety that everyday stresses may appear insurmountable. The tension is not exclusive to the patient, but can also be experienced by the caregiver and other family members who may be battling with their own feelings of guilt, anger, resentment, and fear. If you, as the caregiver, are tired, even exhausted, these feelings may not be easily resolved and could lead to overwhelming emotional turmoil. Anyone involved in a hospice situation is encouraged to come to terms with inner conflicts. It also becomes necessary to resolve unsettled conflicts between one another. This internal and external mending leads to an appreciation of each other's association and of the limited time you have with one another. This becomes especially important for devotees. Fortunately, as Vaishnavas, we have a wealth of spiritual knowledge available to assist in our transcendence of material hardships. But each of us walks alone on our spiritual journey, and each of us varies in our needs. For some, caring for a dying loved one and preparing for the inevitable loss of that devotee may create more emotional turbulence than for others. Generally, it is helpful to clear away emotional pain that may create obstacles in spiritual life. It has been the experience of many senior Vaishnavas in our Krishna conscious movement that unsettled emotional conflict often surfaces, requiring resolution years later. For this reason, I have included this chapter in order to provide an understanding of what the terminally ill patient may be experiencing on an emotional level, as well as to assist you, the caregiver, in your emotional and spiritual growth at a time when your strength may often be tested. As previously described, grief often begins for the patient at the time of diagnosis. Similarly, caregivers and family members may begin the grief process at this time as well. In fact, anyone who has a relationship with the patient and who will feel a sense of loss by his passing away will experience grief on some level. Just as Krishna consciousness is a process with necessary steps required to achieve greater understanding, grief is also thought of as a process leading to acceptance of one's own death or the eventual death of someone close to us. This concept, involving various stages of dying, has been written about at great length by Elizabeth Kubler-Ross, MD, who began her pioneering work with terminally ill patients many years ago. Dr. Kubler-Ross spent decades caring for the dying, young and old, and found a common thread of emotional thought experienced by those facing imminent death. Similar grief reactions can be seen not only in the dying, but also in those experiencing a traumatic life event, such as a divorce or any life altering occurrence where great loss is felt. Travely, we are at 12:45. So
Yeah, I'm just looking. Yeah, maybe we can just finish 1 minute here, just to finish this section.
this section, okay, okay. As described by Kubler-Ross, the stages of grief are denial, anger, bargaining, depression, and acceptance. It is important to note that not every terminally ill patient experiences all of these stages or goes through them in the expected order. For example, I have seen patients who were passive by nature and had strong religious beliefs. Therefore, they never felt angry when told they had less than 6 months to live. Other patients felt depressed one day and angry the next. These stages are not carved in stone, and certainly a person who is dying has the right to react in his or her own way, own unique way. Similarly, caregivers, family members, and close friends may experience these stages of grief according to their individuality. Sometimes the patient may reach the stage of acceptance while a family member struggles with anger. For example, I once had a 76-year-old patient who had worked hard to accept his imminent death after suffering from congestive heart failure. This strong and caring man, who was a Baptist minister, then spent his final days trying to console his adult children, who unfortunately remained angry even after his death. The following is a discussion of each of the 5 stages of grief in the order in which they are generally thought to occur.
Thank you so much. So I'm sorry we're a little bit, couple of minutes over time, but I know this is a big topic, grief, and Sangeeta Mataji, I'm sure you will have lots more to add with your recent study or certifications in grief.
Yeah, since this was written. Yep, that's true. So we want to continue with,
Yeah, so we'll continue. Actually, next week is our Q&A session.
oh, it is. Okay.
Yeah, it's been 3 sessions now since the last time we had it. So have your questions ready, and we will have a very interactive session like last time.
Okay, great. All right, everybody, have a wonderful week and stay safe and healthy, and we'll see you next Sunday.
Thank you
Okay.
so much again.
Yeah,
Thank you so much,
thank you, everybody.
everyone.
Thank you for putting it on.
Hare Krishna.
Hare
Hare
Thank you.
Krishna. Have a good
Krishna,
week.
Hare Krishna.
Haribol.
Thank you.
Everybody
Hare
take care
Krishna.
this week. Haribol.
Thank
Thank you
you.
very much. Hare Krishna.
Everybody.